Rural communities are the backbone and heart of South Carolina. With over 1.5 million South Carolinian residents living in rural areas, a large part of our state's unique culture and character comes from these communities. But in recent decades, these populations have become overlooked and left without basic support. And a vital sector that has been lacking in rural communities is healthcare. South Carolina's rural population disproportionately faces health complications and challenges due to limited access to healthcare workers, low-funded healthcare infrastructure, and less access to health education.
We are currently standing on Camden Road in the middle of Vance, South Carolina. Vance is home to a little over 100 people and is equipped with a fire station, post office, elementary school, and medical center. We traveled from Columbia, South Carolina to learn more about real health experiences and what life is like in Vance.
Mr. Aiken has been the mayor of Vance for 15 years. We had the chance to explore his experience with the small but vibrant community he leads.
Since I got here, it's been a blessing to see people coming together and want to do some things, want to improve, want to better themselves.
Vance is somewhat of a health hub among surrounding towns, hosting events to help bring awareness to relevant health topics.
We always encourage citizens, if they have anything that can better the community, we ask them to bring it to us.
Do you generally have pretty good turnout and interest in the community?
Yes, especially the cancer walk, the sickle cell walk.
Despite a clear community interest in enhancing general health education, residents lack the support within the vicinity to truly improve health outcomes. As a result, they are ultimately unable to challenge the health insecurity that typically affects rural areas. To learn more about the challenges faced by Vance, we talked to Ms. Davis, the director of the James Boyd Davis Senior Center, who gave her perspective on the state of healthcare in Vance.
The healthcare in this area stinks. My primary doctor is 30 miles away, which is Orangeburg. Need something in the area, but I guess what they did, a feasibility study, and it must not be enough. And then the rural area, doctors probably don't want to come.
With long commutes to care, poor coverage of services, and a lack of in-community resources, residents of her community are unable to effectively maintain their health. Ms. Davis believes that these adverse health effects can be generational, and young populations are a key intervention point to turn the tide.
Healthy education should start in elementary school. I think they should have some type of program, and I think if they start from the elementary school, they would eat better.
Even though this town was just an hour out of Columbia, it was shocking for us to see how Vance struggled to support the health needs of its population on its own.
I think the community should rally together, get our politicians to try to do something.
Though these issues hit close to home, Ms. Davis stressed the need for productive conversations on supporting rural health and education at a systematic level. So we did just that.
We reached out to Senator Brad Hutto, the Democratic Minority Leader of the South Carolina State Senate. He's the senator of District 40, covering 6 different rural counties.
We have a real deficit of healthcare workers in rural South Carolina. When I grew up in the late 60s, that was the heyday of medicine in South Carolina. Every small town had a doctor and every county had a hospital. And that's just not true anymore.
To combat this deficit, he also believes that exposing kids to healthcare at a young age is an effective step towards addressing this issue.
Young kids are impressionable. If they see an older student who is excited about what they're doing and is providing them with useful information, it may spark the interest that gives that child exactly what they need to focus on what they want to do for the rest of their lives.
In response to these critical problems, we proposed the establishment of a student organization network within higher educational institutions all across South Carolina that focuses on mitigating these issues and their impact by targeting younger populations. Named MedLM, derived from the words medicine and elementary, this organization network will deliver tailored programming to youth, primarily targeting elementary and middle school age students in rural districts and beyond. The initiative will focus on 2 key components: career exposure and health education. The responsibilities of MedLM as an organization will encompass outreach and collaboration with establishments to identify appropriate audiences for delivering vital information. Additionally, the organization will recruit and train volunteers to present materials designed for easy comprehension and high engagement. University enrichment funding and organization dues will be a sufficient and reliable source of funding. The first component of MedLM programming, career exposure, is designed to introduce rural youth to a range of healthcare professions, with the aim of sparking their interest in pursuing careers in healthcare. Various initiatives such as poster presentations, discussions, and interactive activities like a career matching card game will be employed to inspire and motivate young individuals to explore various healthcare professions. Here are some sample posters that were designed. By providing these career exposure initiatives and instilling a passion for healthcare careers in the younger generation, we aspire to mitigate the challenge of rural healthcare worker shortages. The second component, health education, aims to implement comprehensive health education programs tailored to youth populations in rural areas. This portion will cover a broad spectrum of topics, including first aid, hygiene, nutrition, exercise, and mental health awareness. By equipping children with this essential knowledge, our goal is to promote healthier lifestyles at an early age, thereby contributing to overall improvements in rural community health. Utilizing interactive methods such as hands-on activities, these programs will effectively engage participants and impart knowledge about responsible health practices. An example activity targeting nutrition could involve using toy plates and food items. Participants would physically assemble both healthy and unhealthy meals, explaining the components of each plate, their nutritional significance, and why nutrition is vital. By engaging in this hands-on activity, students not only learn about healthy eating habits, but also practice applying their knowledge in practical scenarios. MedLM currently exists as a flourishing student organization at the University of South Carolina and serves as a proof of concept for the implementation of this idea. UofSC MedLM was founded in October of 2022 and has grown tremendously since. The recent accomplishments of MedLM demonstrate its potential in rural areas. As of today, the organization has spoken with nearly 2,600 elementary students about various health topics, has garnered over 250 college student members contributing to its mission, mobilized over 350 volunteers to serve the community, and raised $4,400 to support the cause. We have established partnerships with various elementary schools, district-wide YMCA programs, a homeless center that serves families with children, the South Carolina Juvenile Detention Center, and more. MedLM is structured to benefit all parties involved, including our target youth audience and the older students implementing the program. First and foremost, the youth we interact with will experience tremendous benefits. By participating in career exposure activities and interacting with pre-health students, we aim to ignite a passion within them to pursue careers in healthcare, hopefully mitigating the rural healthcare worker shortage in the future. Through health education activities, we hope to teach and encourage healthier habits such as following a nutritious diet, embracing positive mental health, and consistent exercise, thereby improving the health outcomes and quality of life of rural citizens. Simultaneously, university students implementing the programming will gain experience working with diverse rural populations, encouraging them to develop an interest in rural communities and hopefully pursue a career in rural healthcare. By serving the community and promoting healthcare education, they too will contribute to improving health outcomes. Besides addressing systematic issues in South Carolina, the MedLM program will provide college students with leadership, clinical, and personal development opportunities. Simultaneously, the younger generation will look up to and be inspired by the diverse group of older students pursuing healthcare careers.
MedLM has come far in the past 2 years, and now we're excited to go even further as we aim to engage rural communities. MedLM is a conduit we created to channel our passion into tangible health outcomes, and now we invite you to be a part of our mission. Rural communities are the heart of South Carolina. Though modest in population, they have a unique and monumental sense of community and compassion.
If you come into town, you see on the sign say the home of family reunions. We expect people to come and be like a family.
Witnessing the health struggles that these spirited communities face has been an eye-opening experience for our team and has served to validate the importance of our endeavor. To preserve the culture, the individuals, and the community connections of these small towns, it's necessary that these populations can be autonomous in managing their own well-being. As the state of rural health falters, we must jumpstart health education and career development at the grassroots level to keep the heart of South Carolina beating strong and healthy.